Okay, awesome. So this is my presentation on the German healthcare system. An interview I conducted with my roommate back at college. Her mom is German. Marie's half German. Lynn, the mom, was born in Munich, Germany, and lived in Munich for 30 years before coming to the US to have her two daughters. It's me and my roommate in the corner. Um, but didn't get that maternal healthcare perspective because both Marie and her sister were born in the US. But Lynn did have a lot to say about her time in Germany. She's lived in Redding, California since 2009, but frequently Marie and her mom will return for months at a time to be with family and all their families there. Um, and so before I launched into the interview, I just wanted to kind of research for myself what exactly the German healthcare system is kind of modeled after. So the first is that I found it very similar to what we've discussed about France in our class. So it's the Bismarck model, and basically there's a mandatory public health insurance that everybody buys into via income tax paid to the federal government. The federal government will then pay public health insurance companies to kind of run the operation of it all. Um, and you can opt out of this public health insurance, which in Germany is called the GKV, which translates to a very long German word, but they call it the GKV. And it's legally required for certain groups, people who fall below a certain income level, and also students who are enrolled in state recognized institutions under the age of 30, which I thought that age was very interesting, it being so high. And then additionally, dependents of those individuals that I just mentioned. GKV covers primary care, hospitalizations, prescriptions, dental, maternity and childbirth. Usually there will not be a bill at the end of the appointment unless it's a specific kind of prescription or a specific kind of dental care. So there are bills involved, but not often. So Germans can opt out of GKV, like I said, and use a private health insurance. This is usually for higher income earners, but about 89% of Germany uses the public insurance and only 11% uses private. So this is a list of the questions I asked to Marie's mom. I won't go over the main ones, but the three that I added myself had a lot to do with clinical empathy in the healthcare system. I was interested in how she kind of felt personally while going to the doctor, and how kind of her doctors in Germany care for her as opposed to in the US. And then I just asked her kind of what a start to finish experience is like at a general practitioner, or she still goes to her allergist very often in Germany. And then I asked, what was a specific instance you were impressed or disappointed in your healthcare system? So the overall tone of this interview was very, very positive, I would say. She had a lot to say about her trust in German healthcare, about the high quality, and just about the affordability of it all. First off, she said that she did notice up front, living in Germany, that her taxations are high relative to healthcare, but it wasn't something that specifically bothered her because she recognized just how efficient and easy her system was. She was very impressed with the quality overall throughout her life. Um, Lynn has used public health insurance her entire life while she lived in Germany. But now, when Lynn and Marie will go back to Germany for extended periods of time, her parents do have a private provider. So occasionally, if there's something out of pocket or a prescription is not specifically covered by public health insurance, Lynn and Marie, as dependents of Lynn's parents, are able to use that private health insurance, which I thought was really interesting. Um, yeah, she said it was overall much cheaper than in the US, obviously. And then, just like I said, it was kind of refreshing to hear somebody who was very confident and very happy with their healthcare system, because we've gotten so normalized in the US to just complain about how expensive healthcare is. In terms of just the general visit of it all, it sounded very similar to what we've talked about with France. The doctor's offices kind of look like homes, and there's no waiting room. There's no receptionist. It's usually just a nurse kind of guiding you through the practice. Um, Doctor's offices, this I thought was interesting, usually will have pharmacies right below them. So after an appointment, she said it's very quick and easy to go down, basically down a staircase and go straight to the pharmacy and pick up your prescription. So you're kind of into the doctor, you get everything you need, and you leave, and you don't have to think about it. She talked very highly of the streamlined process. So tests and pharmacy orders and examinations will all be performed in the same location, and she's not running around Munich. Very many specialized doctors, especially in Munich. Her perspective, again, is one of the biggest cities in Germany, so it definitely will be different than other places in Germany. But then she said at the end of her appointment, she's only billed if a prescription is involved. That's maybe not a commonplace prescription, and usually that's 20 to 40 US dollars. So these are a couple anecdotes from the interview about German healthcare. The first is a quote. She said, "My German healthcare is much more efficient than in the US. When I go to the doctor, my problem gets solved during the appointment and the day of. Even if I have to wait in line for 2 hours, I have an answer to what is going on with me in the same day." There's a mention of those wait times, which she said people would think would be an issue, but she has not really found it to be an issue thus far in her experience, even though it is socialized medicine, and that's a common complaint. Secondly, she talked of just her high trust. She, despite trying to go in the US, still goes to her German allergist every time she's back, and she finds the process very streamlined. She says that the tests are very intentional and nothing feels unnecessary or random about it. They'll only perform a test if they really do think it'll help her and improve her overall experience. And then in terms of clinical empathy, she just said that she feels a lot more cared for in Germany by her doctors, a lot more personally listened to than in the US by medical professionals throughout her life. And then finally, I thought this was interesting, but her husband, who's American, while Lynn and her husband were in Germany for an extended summer, the husband was experiencing some stomach issues and went to a Munich specialist. And the ultrasound, the appointment, and the prescription were all completed in the same day and cost him, a non-citizen, $83 out of pocket at the end of the appointment. So these are the main themes I gathered. First off is, again, it was a very positive interview. She truly believes that doctors go more in depth and take more time to comprehensively understand her problems. And she kind of attributes that to the fact that the German healthcare system is not a for-profit system and they're not performing unnecessary tests to make more money. And then just again, the cost and accessibility, high quality, and the level of trust overall were major themes. In terms of negatives, I asked her about wait times and what her experience was like with that, and she said that overall it was not very noticeable for her. Again, having lived in Munich, that's probably different than others' experiences, but she said that she has had similar or even worse experiences in the US, and usually if she books in advance, it's not a problem. And then finally, in terms of potential negatives, she did mention privacy as something that is not a personal issue to her, but if people are not accustomed to going to the doctor and having to get completely naked, then potentially there's room for a problem, but that's kind of the only complaint she had about her healthcare system. And these are some of my sources, and that's all. Thank you.